Dr. Fauci, the government recommends everybody take a booster over age 5. Are you aware of any studies that show reduction in hospitalization or death for children who take a booster?
Right now, there's not enough data that has been accumulated, Senator Paul, to indicate that that's the case. I believe that the recommendation that was made was based on the assumption that if you look at the morbidity and mortality of children within each of the age groups, 0 to 5, 5 to 11.
Right. There are no studies, and Americans should all know this. There are no studies on children showing a reduction in hospitalization or death with taking a booster. The only studies that were permitted, the only studies that were presented were antibody studies. So they say if we give you a booster, you make antibodies. Now, a lot of scientists would question whether or not that's proof of efficacy of a vaccine. If I give you 10, or if I give a patient 10 mRNA vaccines and they make protein each time, or they make antibody each time, is that proof that we should give 10 boosters, Dr. Fauci?
No, I think that is somewhat of an absurd exaggeration. Senator
Well, that is
Paul.
the proof that you use. Your committees use that. That's the only proof you have to tell children to take a booster is that they make antibodies. So it's not an absurdity. You're already at like 5 boosters for people. You've had, 2 or 3 boosters. It's like, where is the proof? Now, I think there is probably some indication for older folks that have some risk factors. For younger folks, there's not. But here's the other thing. There are some risk factors for the vaccine. So the risk of myocarditis with a second dose for adolescent boys 12 to 24 is about 80 in a million. This is both from the CDC and from the Israeli study. It's also in the VAERS study, remarkably similar for boys, much higher from boys than girls and much higher than the background. The background's about 2 per million. So there is risk and there are risks. And you're telling everybody in America just blindly go out there because we made antibodies. So it is not an absurd corollary to say if you have 10. In fact, you probably make antibodies if you get 100 boosters. All right? That's not science. That's conjecture, and we should not be making public policy on it.
So, Senator Paul, if I might respond to that, we just heard in his opening statement, Ranking Member Burr talk about his staff who went to Israel. And if you look at the data from Israel, the boosts, both the 3rd shot boost and the 4th shot boost, was associated with a clear-cut clinical effect, mostly in elderly people, but also as they gathered more data, even in people in the 40s and the 50s. So there is clinical data.
But not in children.
Well,
see, again, here's the thing is you're not willing to be honest with the American people. What is the incidence of hospitalization and death for children who've been infected with COVID, subsequently going to the hospital or dying? What is the possibility if your kid has had COVID, which is 75% of the country's had COVID, what is the chance that my child's going to the hospital or dying?
If you look at the number of deaths in pediatrics, Senator, you can see that there are more deaths
of people who have had it, of people who have had the disease.
Senator, we also know from other studies that the optimal degree of protection when you get infection is to get vaccinated after infection. And in fact, showing reinfection in the era of Omicron and the sublineages, that vaccination...
But you can't answer the question I asked. The question I ask is how many kids are dying and how many kids are going to the hospital who've already had COVID? The answer may be 0, but you're not even giving us the data because you have so much wanted to protect everybody from all the data because we're not smart enough to look at the data. When you released data earlier, when the CDC released the data, they left out the category of 18 to 49 on whether or not there was a health benefit for adults 18 to 49. Why was it left out? When critics finally complained, it was finally included because there was no health benefit from taking a booster between the 18 to 49 and the CDC study.